Hi viewers, welcome back. In today's class, we are going to talk about the congenital heart disease, and in congenital heart disease, cyanotic heart disease. Cyanotic heart disease is nothing but it is the blue baby. In the first class, you remember the baby is blue in color because of cyanosis. So in all your cyanotic heart diseases, the shunt is from the right side to the left side. So right side shunt to the left side shunt, what happens? Deoxygenated blood enters the oxygenated blood, and from there it is going to aorta for the systemic circulation, where the baby will land up with cyanosis. So this is the core factor you have to remember. So in the cyanotic heart disease, we have three conditions. The first condition is your transposition of great arteries. Okay, so you have to remember two great arteries, that is your pulmonary artery and the aorta. These two arteries are going to have a transposition, that is mismatching of the position is taking place. So the normal position of your aorta is from the left ventricle. The pure blood, it takes the pure blood through the aorta and it goes for systemic circulation. But here what is happening, instead of getting connected with the left ventricle, it is getting connected to the right ventricle. So when it is getting connected with the right ventricle, what happens? It will take deoxygenated blood and it goes for systemic circulation, where the baby is landing with cyanosis. Similarly, what is happening? Your pulmonary artery, where the pulmonary artery is supposed to get connected, it is supposed to get connected with your right ventricle. So here, instead of connecting with the right ventricle, it is getting connected with the left ventricle. So left ventricle, already there is purified blood only. So taking that purified blood, it is again going to the lungs for purification. So now you are able to understand. So this the two major arteries are in the different position, or it is in the mismatch position. Both the things are doing opposite functioning. So usually the baby will present with cyanosis, as because the blood from the right ventricle is going for circulation, which is deoxygenated blood. So the baby will have cyanosis. So when there is a cyanosis, automatically your compensatory mechanism, the child will have severe breathing difficulty and the child will have tachypnea. So followed by that, there will be increased heart rates will be there and murmurs will be present, followed by cold and clammy skin with the baby. Okay, so this is with the signs and symptoms of your transposition of great arteries. And then we have management. Here what management we are going to do? See, in all your septal defects we have seen, we gave indomethacin. That is a prostaglandin inhibitor. So what it is going to happen? It is going to close the shunt. So now what we are going to do? We are going to give IV prostaglandin. So when we give prostaglandin, what is happening? So your shunt will not close and it will be opened. So coming to the management of your transposition of great arteries, first management is your IV prostaglandin you are going to administer. What is this action of this prostaglandin? So this will not allow the shunt to close. Okay. So what we are suspecting is, when we are not allowing this shunt to close, where is this shunt? It is in the atrium or your ventricular, there is a shunt opening. Okay, so which is going to allow this mixing of blood. Now we don't want this shunt to close. So what is going to happen? We are opening the shunt and keeping. So what will happen? Already there is a mismatching of the positions. So you are suspecting at least mixing of blood will take place. So instead of pure deoxygenated blood going in for systemic circulation, when there is a mixing takes place, at least 50% of oxygen will be carried to the aorta, and so that it will go in for systemic circulation. You are able to understand my point of view. Instead of this right ventricle, which is leading to aorta, which is carrying 100% deoxygenated blood for systemic circulation, we are allowing the mixing of blood to take place. So what is happening? At least 50% of oxygenated blood will enter into the right ventricle, and from right ventricle through the aorta, this 50% of oxygenated blood will go in for systemic circulation. So this is the logic we are suspecting, and we are allowing mixing of blood to take place. So we are giving IV prostaglandin to keep the shunt open. Then what we are doing is your switching off procedure. Okay, that is switch operation procedure we are going to do. So what we are here, instead of the aorta getting connected to the right ventricle, we are taking the aorta and we are getting it to the normal connection of your left ventricle. Similarly, pulmonary artery getting connected, that wrong connection, that you are taking that pulmonary artery and you are keeping it in your right ventricle, and it will go in for pulmonary circulation. So that is like already that mismatching was there, no? So that you are going to rectify and you are giving a correct position so that the oxygenated blood goes in for systemic circulation, deoxygenated blood goes into the lungs for purification. So this is your switch off circulation. So where your aorta is getting connected with the left ventricle, which is going to give pure oxygenated blood for systemic circulation, and your pulmonary artery is getting connected with the right ventricle, which is taking the blood to the lung for purification. So this is what with your transposition of great arteries. Hope you understood the class. In case if you have any doubts, give your comments in the comment box. Till then, we meet in the next class. Take care. Bye.